The NHS has been under real pressure this last winter, so we decided that we would work in a different way to try and get people back to where they wanted to be as quickly as possible and get them to be as independent as they can in their own homes, in their community, with their friends and family around them.
This winter's been really challenging, and I've been delighted with the integration between our colleagues in health and social care who've put aside ways they've used to do things to make such a difference for residents.
In the Royal Borough of Windsor and Maidenhead, social care and health partners have come together to support discharge out of our hospitals differently. If someone has been identified as needing support to return to their home and no longer meet the criteria to reside in hospital, then Home First will aim to take them home. Our team will meet the individual and gather information from the nursing and therapy teams on the ward. This enables us to work out what is needed to get that person home safely and with all their needs managed.
Home First is getting people out of hospital quickly when they're ready to, and trying to remove the delays that might have been caused by trying to find a package of care. It's not the place and the time to make that decision about what your future might look like. So Home First is, let's get people home, get people settled and safe, and then work really hard and give the person every opportunity to become the best person they can be.
Home First decision-making process is slightly different than traditionally how we've been working. We look at what is safe for the person to go home immediately, but we hold off on making any big decisions about what care that they need for long term.
It's a whole process. You look at the patient as a whole person, everything. So you do the care, make sure they're good enough to go home.
Well, the team came to the hospital and we talked about what was going to happen to me next. Well, I was going to be taken home and make sure I had everything I needed.
From the first day after discharge, someone from our team will come and check that everything is in place at home as planned and will make adjustments as needed. We have twice weekly meetings where we all get together as a team. Then over the next 2 weeks, we all work together to maximise the individual's potential and establish what the long-term possibilities are and support the individual and their family to plan for those. The long-term plan could include a longer period of reablement, a placement, a long-term package of care, or the resident may have reached full independence and have no further needs.
I think that some of the best benefits of Home First are that we're getting people home quicker and that we are more responsive to their needs within their home and their own home environment.
Home First is different because we are integrating organisations, professionals and services. Staff from different organisations work together every day. They do joint visits, joint assessments, and they share the decision making. All this comes together to ensure that our residents get a personalised, needs-based approach. We are supporting our carers to work in an enabling way, rather than the traditional time and task approach to domiciliary care.
The challenges we've had with Home First have been a different working style for our carers. So usually they're given quite direct instructions about what's needed for the person they're caring for. But in this case, the challenges have been that they can actually respond to the person's needs, and that's new, but it's something they've always wanted to do. So actually it's been quite a welcome challenge for a lot of our carers. They're part of a group now that's making decisions about the care that's given to the residents that they see on a very regular basis.
We go over there, we assess those clients and we see what the clients can do by themselves, and we try to encourage them, try to make them motivated to do some things by themselves so that they can get back to the life where they were as a normal.
So we're assisting them than actually doing things, so it's good for them, good support for them.
Just got back from hospital, a bit worried about her balance.
Working within Home First, it's really good that I have access, or I can talk to other professionals. So I've got access to nurses, to physiotherapists, to remote monitoring teams that keep an eye on people's blood pressure and stats, whereas previously I would have struggled to get hold of such professionals. It's now good that we have access to this and we can support keeping people at home much more effectively.
Home First also works closely with our remote monitoring team. This is where equipment is put into the home to enable the resident to take daily health readings and also answer certain health and welfare related questions. This enables our team to monitor the status of the individual after discharge and react accordingly to avoid further hospital admission.
We will get patients' observations being called into us daily, and if there are any changes in their blood pressure, their pulse, their temperature or their oxygen levels that we deem necessary to go and visit the patient, we will do that.
Home First has already proved to be successful. In the first 6 months alone, we have supported 270 people. We have reduced the average time to discharge to 2 days. We have reduced the packages of care by 60%. In addition to all this, our teams have thrived in the integrated working environment.
I'm so used to being hospital-based, so I'm learning how it's important to know the home-based, but this I can only get from the multidisciplinary team. But then when I joined the team in Home First, initially I was a bit not sure if I'll do it. But what has made me so excited about it is the fact that I can actually go and tell someone that I'm going to help you go home.
It's been a fantastic experience actually. Everyone that we've worked with has been so keen to have the same quality of service, the same kind of mission, which is to get that individual back to where they needed to be.
Working with Home First has been really good actually, because we've met so many different people from different sectors. So we've met with the nurses, the occupational therapists, the physios, and then just lots of other people behind the scenes, which we never knew about before.
The difference between Mother being in hospital and at home was the service felt very personalised, because they said, "What would you like us to do for you?" And they came up with the goods every time. It made a huge difference to my mother's confidence and moving forward in a non-hospital environment, so that was good.
I've supported Home First so wholeheartedly because it's made such a difference to our residents, being able to get them out of hospital as soon as they're able, back into their own homes where they feel safe and comfortable, makes such a difference to their long-term chances.
It's really important that we just don't continue to do what we've always done. What is so important when resources are so tight is that we change the way we work. And one of the things that Home First has tried to demonstrate is that we can work in a different way, move beyond silos, and in doing so, we can get people back home quicker than we have ever done before.
I think the service was excellent. I think you did everything that was possible to do. I'm very thankful for that as well. They treated me very, very well.